Good evening, everyone. Thanks for joining us tonight. We're excited. It's our first webinar for 2021. That's where I think we're starting it off with a really topical topic tonight. So I want to go ahead and introduce myself. I'm Dr. Zarami Shanawaz, Medical Director here at Face to Face Health. Thank you once again for joining us. I want to take it over to our founder and CEO, Dr. Ami Shah, who will just tell you a little bit about Face to Face and our wonderful platform. Over to you, Ami.
All right. Hi, everyone. Thanks for joining us tonight on a nice, warmer Wednesday evening here from New York City. My name is Dr. Ami Shah. I'm the founder and CEO of Face to Face Health, but most importantly, I'm a mom who faced challenges with her children. I was working and I had no way to help them. So I went through a journey, and through that journey, I realized it takes a team of wonderful individuals like Tania and Zarmi and other provider types we have on our platform, but not only people and having access to them, but access to the correct information that you can understand and digest and support in communities. So that's what we built. We built a one-stop shop platform that gives you the tools and resources to make sure you and your children are doing awesome. And we hope you enjoy our webinar tonight, and go to f2fhealth.com to learn more. And I'll welcome you and pass it right back to Zerm.
Thanks, Ami. So as you all know, tonight's webinar is about eating disorders, which we felt was particularly relevant now, given all the extra pressures that our children are under with the pandemic. And so to help me explore this issue tonight, I am thrilled to introduce Miss Tania Cuadra. Tania is an integrative and functional medicine nutrition registered dietitian and health coach who currently practices as a clinical dietitian and lifestyle coach virtually, as well as in private practice in New York. She has extensive experience working with adolescents with eating disorders through the Center for Discovery at Menlo Park, California, as part of the team in the Coeducational Adolescent Eating Disorder Treatment and Recovery Program. Welcome, Tania.
Hi, thank you for having me.
Thank you for helping us out tonight. We're looking forward to hearing about your expertise in the area. It's certainly a very heavy area of practice. So Tania, I want to start the conversation off tonight by actually sharing a statement. And the statement is this: eating disorders are a lifestyle choice. I've certainly heard this in my practice, and I'm sure you've probably heard it many times. So, let's talk about this. What are your thoughts?
Well, I mean, I think it's very dismissive. I mean, eating disorders, I think it's easy to say that, someone is choosing to, behave and act in a certain way when it comes to their beliefs and behaviors around food and eating. And that's really not the case. They really are complex mental illnesses, and there are things going on there that are both biological as well as environmental. So there's a lot of things that affect someone who is living with an eating disorder.
Yeah, so I do think this is probably one of the most common myths that practitioners come across. And it really, as you say, it minimizes the problem, and I think forces a lot of undiagnosed cases to kind of go under the rug.
Yes, I definitely agree. I think that there are a lot of ways of eating and certain behaviors that maybe have become more normalized in our society, and I think that makes it harder to understand what eating disorders and disordered eating is and what it looks like. So I'm excited to sort of get into that in this webinar.
Yeah. So when we talk about healthy eating, what does healthy eating actually mean?
So here you can see on the slide, this is just a real simple definition for healthy eating. Essentially is normalized, non-disordered eating is when one mindfully consumes food when hungry and is able to stop when satisfied. And they incorporate variety in their diet without provoked anxiety or feeling of guilt or shame. So some key things that I just want to pull out of this definition are that food choices mainly are influenced by hunger and preference. That's sort of a key thing when we're thinking about normalized, non-disordered eating. Also, the intent and feelings behind eating, so there's no guilt or shame around food or eating, so food choices or eating pattern and behavior. And there's no significant difficulty eating in social situations and things like that.
Right. And again, as we kind of were alluding to before, this is kind of like a biopsychosocial issue. So it really does affect, you know, all facets of a person's life, whether it's out with their friends, whether it's eating at home, concentrating at school, and of course, there's the developmental and physical growth aspects of it as well. So that kind of brings me along to our next slide. And I know that we have a couple of definitions here. If you could just kind of go through these definitions for us and kind of explain what that all actually means.
Sure. So you might hear two different terms. So there's disordered eating and there's eating disorders. Now, eating disorders are what we are talking about when we're talking about the actual, an eating disorder has specific diagnostic criteria. That's something that a doctor is going to provide or a psychiatrist may provide through an actual diagnosis. Disordered eating is more of a descriptive term, so I'm going to start with that. When we're talking about disordered eating, this is going to cover a wide range of irregular eating behaviors. It may or may not warrant a diagnosis of a specific eating disorder. It's, like I said, it's just a descriptive phrase. It's what we use to describe what is going on with the behaviors. So when we look at eating disorders specifically, these are the illnesses in which people experience severe disturbances in their eating behaviors and related thoughts and emotions. And there are various types of eating disorders, which we can discuss a little bit further if you like. But like I said, they have specific diagnostic criteria.
Okay, if you don't mind, actually, I'm just going to stop sharing this now. If you don't mind actually going into perhaps just very generally what the different types of eating disorders are, or perhaps the more common ones that clinicians might be presented with, or even parents might be presented with in their children.
Sure. So there are three main types of eating disorders. And then there's one sort of generalized diagnosis, and then there's an up and coming. So the three main types, we have anorexia nervosa, and that's typically marked by significant low body weight. We see a very intense fear of becoming fat and gaining weight. That's usually paired with distorted body image. And then there's subtypes within that diagnosis. So there can be a restricting type, and there can also be a binge eating, purging type. This is happening with low body weight being maintained. The second is bulimia nervosa, and this is characterized by a pattern of binge episodes accompanied by compensatory behaviors that are aimed at preventing weight gain. So compensatory behaviors are going to be things like vomiting or over-exercising. So when they're binging, the behavior following that is something to help sort of alleviate or relieve what has been taken in. And typically with bulimia nervosa, they are not underweight. They can be normal weight. Sometimes they can be overweight. And it can also cross over with anorexia nervosa and binge eating disorder. Binge eating disorder is actually the next third main type. And that involves out of control eating episodes that are followed by distressing feelings such as guilt or shame. And we typically see this in the absence of inappropriate compensatory behavior. So that's what makes it different from bulimia nervosa. But it's paired with notable distressed feelings about the eating behavior. It's actually the most common eating disorder. And we see this as a more even gender distribution. And the prevalence does not differ among racial or ethnic groups with this specific disorder. With this disorder, the person is more likely to be overweight or obese. And then again, there can be diagnosis crossover with anorexia and bulimia. The more generalized eating disorder diagnosis there is called, well, it used to be EDNOS, which was eating disorder, not other specified, but now it has another name, which is offset, which is other specified feeding and eating disorder. So that can be a diagnosis that's given if someone has different diagnostic criteria from the different disorders. And so you'll see various behaviors within that specific diagnosis. And then the new up and coming one, which we're seeing a lot more, is ARFID, which is avoidant restrictive feeding and intake disorder. And we're seeing this a lot in children and pediatrics, typically young males actually. And this is a eating or feeding disturbance, and it's characterized by a persistent failure to meet appropriate nutritional or energy needs without body shape or weight concern, but we see more unhappiness about thinness and then more sort of pride around weight gain. But those are the more heard about, talked about, and diagnosed disorders. There are others.
Yeah, so it's interesting actually that I think out of those 5, 2 of the ones you mentioned tend to be more prevalent in men or boys, which actually brings me to our next myth, which is, if you bear with me while I share my screen again, which is this one: eating disorders only affect girls. And again, I think this is a very prevalent idea. So, you already kind of, I guess, busted that myth with just the information that you've given us now. But can we go into this a little bit more?
Yeah, so, eating disorders are very interesting because, they really affect all people. This is something that eating disorders in general were thought to really predominantly affect young white women, and that's really not the case anymore. We see this across the spectrum. They affect people of all genders, all ages, all races, ethnicity, sexual orientation, socioeconomic status, weight, body size, and shape. It can affect anybody. And as we start coming away from our previous way of thinking in that it generally affects young white girls or women, we're starting to see some statistics come up in terms of various populations out there. As we become more aware of the things to look for, we're able to diagnose and look for these certain signs and symptoms in various populations.
Yeah, I think one of the stats that I read, according to the Child Mind Institute, they estimate that 1 in 3 to 4 people struggling with an eating disorder is male. And then if we're talking about subclinical eating disordered behaviors, like the ones that you mentioned, men and women are nearly kind of 50-50. So I thought that was a very interesting statistic. So Tania, going back to those statistics then, what are kind of the major risk factors?
So I think looking at the major risk factors, so there's a couple. So first, there's an understanding that genetics do play a role. Having a genetic predisposition, however, does not automatically mean that you will develop an eating disorder. There are definitely environmental and
Oh, Tania, we've lost you.
oh, can you hear me?
Yes, we can hear you, and we've lost you on video again for some reason. I wonder, are you able to switch your video back on, or should I make you a host again?
Yeah, I think you have to make me the host again.
Yeah, apologies everyone. We are having some issues today with this. And for some reason it's not allowing me to make you a host. Let's see. Nope. Yeah, I'm not sure what's actually, you know what? It says Ami is the host. So Ami, you need to make Tanya the host so she can switch her video on, please.
Remember, there's no button here to make her the host.
If you actually click on your video screen, there should be
Hold
some
on.
options for you.
Video.
Is it
Choose video filter. Nope. Choose virtual background, video filter, video settings. Hold on. Participants. Nope. Nope, dear. There
so
is
if you
not.
click on participants and you go to panelists, are you able to click on Tanya's name on her video and see if you can make
Panelist Tania Moore. Make
Yep.
host. Yep, you got it. Thank
Perfect.
you.
No problem. So Tanya, you should be able to switch your video
I know.
on.
I think there's something funny going on with Zoom tonight because my video won't turn on now.
Something definitely funny going on. So let's keep you as host, Tanya, because you're the most important person here tonight. So sorry, continue. We were talking about the genetic predisposition.
Yeah, so there's evidence that suggests that heredity may play a part, although many do not have a family history. Like I was saying before, just because you have the genetics doesn't automatically mean that you will develop an eating disorder. This just means that the risk is higher. So there's environmental and social implications there. So interpersonal issues, things that have to do with abuse and trauma, unhealthy family and personal relationships, that all contribute to the environmental factors that are associated with eating disorders. We also see a lot of coexisting mental health. So in a lot of cases, eating disorders can occur together with other psychological disorders like generalized anxiety disorder, panic disorder, obsessive compulsive disorder, as well as attention deficit and hyperactivity disorder. So those are just a few things that we've seen strong links between emotional and physical health, and that's also where eating disorders where they lie.
And certainly some I guess we could call it genetics, but also personality traits, the sort of high achieving, overachieving, perfectionist kind of girl or boy. We tend to see this kind of need for control more often as well.
Yes, absolutely.
Yeah. And so what are some of the, just really briefly, what are some of the potential, I guess, outcomes of someone who has an eating disorder, which may, goes undiagnosed?
Sure. So that's really going to depend on the specific eating disorder because there are different behaviors going on there. But just generally speaking, some potential outcomes can be malnutrition. We see some significant nutritional deficiencies, significant weight loss, underweight, failure to achieve expected weight gain, and sort of certain growth markers for children. Heart problems, kidney and liver failure. There can be bone density loss and osteoporosis earlier in life. We see imbalances in electrolytes, irregular blood sugars, hair loss, and really in the most extreme cases, they can be fatal. Conditions can result in death.
Yeah. Yeah. And just to kind of talking about these issues, we have COVID right now. Kids have been on lockdown pretty much for a year. What are your thoughts around COVID? How has COVID affected the rates of eating disorders, and why do you think this is happening?
So with the pandemic, there's definitely been an uptick in the eating disorder population. And I'd say one place to start with this has to do with trauma. So, the pandemic itself was such a tremendous stressor for so many in a lot of different ways. And so when we look at the development of an eating disorder, there's typically some sort of triggering point. So there's something that generally happens that can be a very life-changing sort of traumatic experience for that person. And then that sort of perpetuates this sort of downward spiral in terms of developing an eating disorder. And so it can follow an interesting timeline where you have the trigger. So in this case, it could be the pandemic. And then there's the factors that surround it. So with the pandemic specifically, we saw, the lockdown. So that was huge social isolation. So, losing support systems, not being able to have that one-on-one contact and interactions with loved ones and friends. That definitely, I think, plays a huge role. Also, there's sort of this, what's the term? It has to do with scarcity. So with the pandemic, there were sort of different groups of people. There were those who were overstocking their pantries and, sort of hoarding and keeping lots of food in the home. So for someone who might be teetering with bulimia or binge eating disorder, so having that food, that wide amount of food available in the house, that could be very triggering. And then also for the restricting types, so the fear of running out of food, so could lead or perpetuate some more restrictive types of behaviors, like I can't eat my food because I don't want to run out of food. So it's complicated and it's interesting at the same time, but there were definitely a lot of things that came out of the pandemic that were not good for those with eating disorders.
Yeah. And I think the couple of things that we also discussed with kids in particular is this, due to the social isolation, is this increased screen time and the effects of social media. And then the, often the decreased accessibility to medical care and, regular screening with their pediatricians, for example.
Yeah, so, with the decreased screening, a lot of times, things get missed. So yeah. Especially if the appointment doesn't allow for face-to-face, like there's no video and it's just a phone call.
Yeah.
So, it's hard for a practitioner to, see what's going on. Someone can easily hide some weight loss or weight gain and things like that. So it makes screening very difficult. And the increased screen time is really difficult, especially for parents just to monitor and be aware. And you don't know all the time, what children are looking at in terms of their Instagram and their TikTok and their Facebook. And there's just so many platforms and so many people on there, and it's hard to understand what they're seeing.
Yeah, it's a whole nother level of pressure. And just to your point, from a family practice perspective, a lot of people were not taking themselves and they were not taking their children in for just their regular well checks because of the fear of COVID. And so, screening with your pediatrician or with your GP is such an important part, monitoring weight and development. So I think a lot of that was getting missed. So again, this brings me to our next set of myth busters, which kind of goes more towards treatment, I guess. Let me just go back to pulling this slide up. As long as they're not super thin, they're okay. And if my child is not vomiting, he or she is not purging. Think these are some that you've already heard. And it kind of brings us to the question of, well, what are the behaviors as parents and as clinicians we should be looking out for in these kids?
Yeah, so, there's a lot to look for. And I think that it can become easy to sort of creates a lot around maybe something that's not too much, but we definitely want to be observant. So looking at a behavior and then an intent behind the behavior is really important. But I think generally speaking, things to look for: frequent dieting, restrictive eating or feeding, a preoccupation with food and different diets and eating behaviors. And then coupled behind that, is there some sort of anxiety and negative emotions and feelings behind that? Is there shame and guilt behind what behaviors they are taking part in? And that can be associated with specific foods. It can be associated with skipping meals. Depends on what the behaviors are. Also things to look for: frequent changes in weight. Does their weight kind of shift up and down? Could be dramatic and could not be, but frequency, so seeing that happening a lot, can be an indicator or a red flag to look out for. Rigid rituals and routines surrounding food and exercise. So are they doing some maybe odd things at the table, like cutting their food up into tiny pieces or chewing their food a specific amount of times, chewing really slowly? Are they overhydrating? Do they drink a lot of liquids before and after their meals to sort of maybe manipulate their appetite a bit? There's a lot of things to really look out for, but I think those are probably the more common and main ones.
Yeah, so we put together these 5 pointers here, just very simple and, as you say, very common for our parents to look out for, which is the constant dieting, restrictive eating, meal skipping, rigid rituals, obsessive exercising, and preoccupation with food, body image, and weight. So I think that's a really good summary of things that we as parents can look out for at home, and, as you say, be extra vigilant. And so this brings me to the next question, which is, well, when should we get help? When is enough and we need to kind of get professional help?
Yeah, so I think as parents, or if you're just a care provider, intuition really plays a big role here. So if you feel like something's not quite right, I think that is definitely going to be a huge motivator for that person to start asking questions and start a conversation with their child. It's really important to not ignore things that seem questionable, and it can be difficult having these conversations, especially with a teenager, but at the same time it can be just as harmful to ignore it. So first it starts with the conversation. So if you're seeing some strange things that are maybe raising a few eyebrows, bring them up in a conversation or in a question to kind of get an idea of what their thought process and intent is behind what they're doing. And then I think from there, there's a lot of resources where a person can reach out and find a referral or find a practitioner who can perhaps provide an assessment to figure out, is there something going on here? Is it a diagnosis? Where along the spectrum are they hitting, and what sort of treatment do they require would be beneficial for them?
Yeah, and so you talked about getting a diagnosis, etc. I mean, as with, I think, anything, this is going to be a multidisciplinary team. So who are the types of people that can help in this situation?
Sure. So initially, I would say most will reach out to their primary care physician or a general practitioner. They'll be able to assess where the child's been hitting in terms of their milestones. So maybe something's come up, with their weight, where all of a sudden, they're not hitting those appropriate gains. There could be things going on developmentally. And so from there, that could be a good place to start. And then that will typically turn into a referral. With the treatment of eating disorders, the team there'll be a medical side, so a physician or a doctor. Sometimes it can be a nurse or a nurse practitioner. There'll be a mental health aspect to it, so a psychiatrist or therapist. Depending on the case, there can also be social worker or family services involved. And then part of that team will also be a dietitian or a eating disorder specialist, registered dietitian, so a special area of certification. And they would be helping with the management in terms of weight restoration, nutrition counseling, and food and things like that.
Right, got it. And I just wanted to point out here, there are some questions coming through, so we will be answering questions in a little bit. So bear with us, and we have a couple of submissions as well from prior. So once again, Tania, this kind of brings us to our final myth that we want to kind of address tonight, and that is restoring a person to normal weight and temporarily ending the binge purge cycle does not cures the disorder. Is this fact or fiction?
So restoring a person to a normal weight or temporarily ending the cycle, this does not cure the disorder. Unfortunately, treatment and recovery is an ongoing process for those with an eating disorder. I think the best way to think about it is really as mental health treatment when someone has a psychological disorder. If you're living with anxiety or living with depression and things like that, it's an ongoing thing, and things tend to be cyclical, where you have moments where things are really great, and then sometimes, maybe we slip and things will come back up. And that's just really because life is always changing. So unfortunately, this is a big myth.
Mm. Okay, and you kind of had alluded to what a dietitian's role is in this. A lot of it, I think, is sort of normalizing the weight as the first step, and then the counseling. And again, your role you'd mentioned, I guess, also depends on the setting, but we've talked about the professionals that can be involved. Oftentimes in these situations, parents feel really helpless. Particularly when they're having to talk to their teenager, who at the best of times is pretty non-communicative anyway. Is there much that a parent can do in this situation?
Absolutely. There's a lot of things that a parent can do. First things first, I think, is making sure that your child is having their well visit. Screening is really essential. So staying on top of those appointments, even if they need to be by phone or by computer, however it needs to happen, it still needs to happen. So that is really essential. Next to that, communication. So like I was saying before, starting those conversations, being mindful about the words that we choose to use and how we choose to center our conversations around food and body image are really important. We definitely want to address the issue, but we got to be mindful of how we speak with our children, especially if they're in a time of suffering. So, making sure that we're not being accusatory, watching sarcastic comments, thinking about a good time to have the conversation is important, making sure that you have the time, you're not going to be pressed for time or trying to rush through it, you're not angry or tired or things like that, can definitely play a role in how the conversation happens with the child. So those communication aspects are really important. Also support, so, making sure that you're managing your own frustration and anxiety is really important. How we speak to our children about our concerns and management of stress and so forth is really important. Social distancing does not necessarily equate to social isolation. So, finding creative ways to still encourage fun activities, whether it's FaceTime dinner parties, I've heard were pretty popular during the pandemic, small gatherings, keeping them on the smaller side. If you're able to be outside or outdoors, that can help because it allows for the space. Also, another great thing that parents can do, is be healthy and positive models. Model good behaviors, display positive coping mechanisms, and just really be informed and educated, know what the things are to look for and know how to get help and what resources to pull from when you need to. But, our children are so receptive and they're just like little sponges. And so, all the things that we do in our minds that we feel are kind of insignificant, you kind of have to realize that, as parents and adults or caregivers, that you're on this stage, and for some children, you're also on this pedestal. So, it can be very daunting and triggering for a child to, constantly hear yourself talk about your own body and self-image and eating and things like that negatively. So that's definitely something to watch.
Yeah, absolutely. I think much of what you said probably resonates with a lot of parents, on the call. I think that being very mindful, as you say, of the words that we use, and of our own sort of micro obsessions, not using particular words, using, the word healthy over other words, for example, is really important. And the other thing which stood out for me was, changing your mindset when you speak to your child. This is not something that they're doing on purpose. This is not something that they can control. This is an illness, and this is how we need to kind of help them along by being very supportive. And of course, education is also key. So actually understanding and knowing what sorts of behaviors to look out for, from before, so that you can actually, early detection is always early intervention. So that's really helpful. So let's just recap those things. Again, I think this slide is really helpful. 5 things parents can do to help. As you mentioned, regular visits, thoughtful communication, healthy modeling, managing personal anxiety, and be informed and even more observant than we already are. So, Tania, it's not all doom and gloom, obviously. There is excellent prognosis with eating disorders and disordered eating. Can we go a little bit more into the characteristics of what that looks like?
Sure. So, really what's going to provide the best outcomes is early identification and intervention. So catching things as soon as you can, can sometimes prevent an actual eating disorder from fully developing. So that's the most ideal circumstance. Yeah. But also the earliest that it's diagnosed and treated, that's where we see the higher statistics in terms of recovery. Overall, we see roughly about a 50% recovery rate. And it's going to be dependent on the type of disorder and then how long the disorder has been going on for. So it's definitely not all doom and gloom. There are many resources and lots of places and practitioners that parents and children can use. And I think that is really the most important thing to keep in mind, is that really for every step there's going to be some program or some practitioner there who will be able to help.
Absolutely. And again, in a way, there's a silver lining that there's a lot of thought and process that goes into helping these children kind of go through this. And you and I had discussed that it kind of gives them almost enhances their understanding about their own bodies and their own mental health going forward.
Yeah, I think that fostering a healthy relationship between food and eating in general is really that's going to really tie into the healthy modeling as a parent or caregiver. So I think that that's something, eating disorders, disordered eating aside, that is just sort of best practice in terms of, what sort of tools are we giving our children to grow upon and to take further. So, teaching our children that, food and diet is sort of this regular thing, and that it's this way to nourish our bodies, and the different aspects that come from that, that help with our growth and development. Those are just, I think, general important concepts that we can teach our children, that, it's not too over the top and it's pretty straightforward, but it gives them an idea of, why it's important to eat well and, how we can do that.
Yeah. So Tania, I'd asked you before the webinar that if there were 5 things that you would have liked parents to take away with them today, if there's nothing else that they remembered from what we've talked about, what would they be? And this is kind of what we came up with, if you could go through this for us.
Yeah, so again, just remembering that eating disorders, they're not a lifestyle choice. They are a complex group of mental health disorders. They can affect any population, all ages, genders, races, ethnicities, sexual orientation, socioeconomic status. Early intervention has the best outcome. So again, you know, being observant and mindful of what signs and symptoms and behaviors we're looking for. Well-rounded, multidisciplinary teams are essential. So, you know, I'm sure many have heard that it takes a village, and it really does on many different levels. And ongoing support is needed over time. So, you know, going back to one of the previous myths, you know, once the weight is restored, is this person cured? You know, once the binging cycle stops, are they cured? And unfortunately, that's not the case. So, you know, support over time, more support, less support, depending on what's happening in that person's life. That'll be something that is a continuing thing.
Yeah. And you've kindly put together, Tania's kindly put together some resources for those of you who need extra information or need help. I kind of snuck in there and put in our face-to-face health webinars and educational modules as well, because we actually do have quite an amazing collection of educational modules related to, you know, adolescent health issues as well as eating disorders on our webinar, on our website. So I would love for you to check that out. We'll kind of whiz through these, Tania, because we do have a few questions and I would like to get to them. So let's actually start with, we had a couple of submissions from prior. One was, how do you talk to a child who insists information gained from TikTok is accurate when it is not? And this is such a great question, because I think we're all asking ourselves this every day with social media.
Yeah, you know, this is so difficult, but I think the most direct approach that you can take is credibility. So anytime, you know, someone on social media, specifically, whether it's Facebook or Instagram or TikTok or, you know, whatever it might be, you know, teaching our children what credible sources are is going to be really important. So who is this person that they're following, and what makes them an authority on health and, you know, dieting or eating or, you know, whatever it is that they're promoting or talking about. So if your child is bringing this forward and showing you, you know, who that person is or what the account is, you know, you can do your due diligence or research together and say, okay, well, let's find out more about this person. You know, did they go to school? Did they study? Are they certified? You know, what exactly are they talking about? I know that some schools are offering some, not necessarily classes, but I think they touch upon a little bit of what's happening in social media in terms of using filters and things like that, that photos can be edited. So, you know, what you see isn't always what's really happening. And a really big thing, especially with eating disorders, is that you can't see someone's mental health. Someone can take a really great picture and smile and look wonderful, and you don't know what's going on behind all of that. You know, it can take 20 pictures to get a good picture, and it, you know, it's very superficial. It's just going to scratch the surface of what's really going on. So I think those are important things to touch upon.
Yeah, absolutely. So credibility, and that goes not just for kids, but adults as well. I think that's another webinar topic unto itself, which we could talk about and would be a great one. I have another question, comes from a clinician. I have a young client who almost refuses to eat all healthy options, concerned about eating disorders, because, you know, I think this particular client tends to be underweight, but could use some tips in helping her nourish her body. What kinds of foods are good for her? I guess what strategies could we employ with someone like her? Mum has tried lots of different things, but not getting lucky on that.
Sure. So So that's an important piece of information there, is that they tend to be underweight. So maybe looking a little bit more into their trend of weight. So, when did they stop hitting those growth markers? In terms of refusing the healthy options, there's a few different tactics you can take. So I find that, this is going to depend on the age group as well, but getting the child involved in the process is really important. So, a lot of times we can be met with a lot of defiance and resistance, but when they're part of the process, that sort of changes the dynamic of things, and it changes the structure of, I guess, quote unquote, power in the equation, right? So, it starts in the grocery store. So, having them pick certain things, having those conversations about the things that they're picking and making suggestions and sort of seeing what their preferences are and how maybe we can make adjustments there. And then bringing that home into the kitchen. So getting them involved in the process of cooking and making the meal is a really great way to get the child to take ownership over what's happening. They can get excited about using the food that they picked that they're going to be trying. They can be excited about, picking the recipe and helping with the recipe and going through that whole process. So, you can take little steps in that direction, I think can be helpful in terms of getting them to incorporate different things or maybe more helpful things as well.
Yeah, absolutely. And a couple of things that I just want to add there actually is one of the mantras that I heard one of our previous dietitians mention also was it's small steps. So don't try to move mountains. Even if you can introduce one small thing at a time, that's plenty. And then the other idea with teenagers in particular is, if they are on Instagram or if they do use social media, to get them, as you say, to be involved in their cooking, and then perhaps post some pictures of what they've made as a way of kind of incorporating that into their kind of cool, lifestyle. So that's, something else that I think has worked with this age group as well. I have lots of questions for you, Tania. I have another one. What can I do about binge eating and having problems with, I'm assuming that's dysphagia and esophagia, problems swallowing, and with having problems with how things look and not being able to eat? So I'm not sure if this is aimed towards more of a developmental disability or that kind of textural issues with food. And if there's any clarification on that question, please go ahead and put that in the chat box as well. I think it was Talisa. Sorry, go ahead.
Yeah, so that sounds like a combination of things. So with the binging cycle, there's a few different approaches that can be taken in terms of intervening in the cycle. Some have tried sort of thought-stopping processes or thought-keeping records. So, in the binging process, typically there's these feelings of feeling out of control with the food and things like that. And so taking a look at the thought process behind it, and then developing the appropriate coping skills depending on the thoughts that are there for that person can be one strategy to help counter the cycle of binging. There can be various ways to sort of help change the cycle. Some have done things along the lines of timed eating. So, meals are for specific times. Also incorporating mindful practices, so sort of bringing the person to have them be more present during the meal as opposed to sort of lost in this thought of, I'm eating and I'm eating and I'm eating and I'm eating so fast and I'm eating so much. But getting them to sit down and kind of go through this process of being present with their meal. So you can look up something, it's called a here and now practice, and it's a nice mindful exercise for eating. Teaches you to sort of tune in to, what your hunger level is, what feelings you're having around that meal. And then it goes through like the steps of the first bite things to look for in terms of sensory things. The other part to that question, sort of, I don't know if this is the same case, which can make it a little bit difficult because it sounds like there's more avoidant restrictive things going on there. And that tends to have more to do with sensory concerns. And so that's going to be important. What's going to be important there is identifying what the fear is behind it. So there can be sort of odd behaviors like only eating certain colors or problems with certain textures or smells, things that are slimy. Oftentimes that can be tied into like a deep fear of choking. And so being able to identify what fear is behind the behavior so that you can appropriately address the fear and then work forward to modify the behavior in some kind of way. So that'll take some investigating on the practitioner's part, but that's a difficult case, especially if they're happening together.
Yeah, it's really interesting. One of my kids had a bad episode with asparagus a couple of months ago. She almost choked, sort of started going down her throat. And since then, she just refuses to eat asparagus because there's that fear of choking. And it's a very real fear. So I chop them up into tiny pieces. I have another question here again, which is more COVID related, but it's a great question. How much is the loss of control that teens are experiencing during the pandemic impacting eating disorders? I've often heard an eating disorder is a form of control over one's life. And with so much out of control right now, I've noticed a greater focus on food and exercise in my teen.
Yeah, so that's a really big trigger in this population, is the sense of control. So naturally with COVID, lots of things went out of control. And so, that can first contribute to the development, and then B, can also contribute to a relapse. So, depending on what sort of coping skills are in place, it's going to determine how, someone is able to mitigate the oncoming stress. So that has definitely played a huge role in the uptick that we've seen in terms of eating disorders and COVID-19. So it's a very good point.
Yeah, absolutely. We had one last question, and maybe we'll just touch on it really briefly. Is there a difference between food addiction and eating disorders? Or is there such a addiction?
Yeah, so there's also, there are like terms and sort of descriptions for certain patterns of like disordered eating, I guess would be more appropriate to say. And food addiction is something that has come up, I'd say probably more recently, especially since we see a lot of the elements of eating disorders taking place in the addiction centers of the brain. So we see real similar pathways and things that are exhibited there. But again, so we look at food addiction, and then again, that's going to be coupled with this whole preoccupation, with food, over preoccupation with food and eating and things like that. There's some research that's gone towards whether some foods actually are not necessarily addictive, but that they secrete certain chemicals in the brain that act on our pleasure centers, and that can contribute to why we want them or crave them so much. So it's kind of an emerging area, but there's not too much research behind it. So I think food addiction is kind of, just a term that you can use to describe something that's going on, sort of a type of pattern, but it's not an actual diagnosis of an eating disorder. I don't know if that answers that question or not.
Yeah, absolutely. Thank you. So we've been going for about an hour. So I think that we should probably start thinking about calling it a night. It's been such an interesting discussion though. I think I could probably go for a bit longer, but let me just go ahead and bring our slides back up. I just wanted to point out here that, Tania is on the platform. She is one of our many wonderful providers. So if any of you do feel that you need to see someone or speak with someone about your child or your family's health, please come to Face Health, and you can see any one of our providers. We are live with all of our different types of consultations, and just visit f2fhealth.com. I just really quickly wanted to mention our upcoming webinar next week, which is Why Aren't Our Kids Sleeping? And we are going to be talking about, sleeping issues, starting from neonates sort of all the way through to older children as well. And of course, the pandemic is not helping that situation either. It's definitely having a lot of ripple effects. So thank you very much again for attending tonight's webinar. Tania, really big thank you to you for sharing your knowledge and your expertise.
Yes, thank you for having me. It was wonderful.
Absolutely. And we hope to see all of you again next week at our webinar. Take care. Have a good night. Bye, Tania. Thank you.
Thank you, Tania. Bye.